Hello guys, today let's talk about the functional areas of the cerebral cortex which are extremely relevant to a case of stroke or cerebrovascular accident. First we will talk about the functional areas in the frontal lobe, then hop on to the parietal lobe, the temporal lobe, and then on to the occipital lobe. So in the frontal lobe, the first area that we are going to discuss about is the primary motor cortex, or area number 4. This area number 4 is located on the precentral gyrus in the frontal lobe. Precentral, why? Because it is situated just anterior to the central sulcus. And where is it located? On the medial surface. So on the medial surface it is located just anterior to the paracentral lobule. So around here is the paracentral lobule, so it is just anterior to the paracentral lobule. So this is the 3D image, and this is the medial surface anterior to the paracentral lobule, and this is the superolateral surface on the precentral gyrus. So what is the function of area number 4? The area number 4 is concerned with conscious control of voluntary movements, conscious control of skilled movements. For example, writing, drawing, kicking a football. All of these actions are controlled by the primary motor cortex via the corticospinal tracts. An important thing to note is that specific regions within the area are responsible for movements in the specific parts of the body. For example, stimulation of the paracentral lobule produces movement in the lower limbs. The trunk and upper limb are represented in the upper part of the precentral gyrus, and the face and head is represented in the lower part of the gyrus. So this brings us to something called as the homunculus, which in Latin means a little man, which is essentially the projection of the body onto the cortex. So this is the homunculus, and this is the medial surface, and this is the superolateral surface. This is the medial surface, and this area is concerned with movement of muscles of the lower limb. For example, if you want to kick a football, neurons in this area will be fired, and they will send impulses down into the spinal cord to that, and eventually to those particular groups of muscles to cause a series or sequence of movements. Similarly, if you want to talk, these neurons will be stimulated the most, and they will send impulses to the muscles of vocalization. So the importance of this is, for example, if you simply wanted to pick up a pen, so for example, if you just want to pick up a pen, all you need is muscle of the hand to work properly. So if there was no such proper distinguished representation of various areas, everyone would be dancing around everywhere. So because to cause a particular function, to cause a particular action, there's a particular area which on stimulation will produce that action. Now let's look at the premotor cortex, which is Brodmann area number 6. It is just anterior to the primary motor cortex. Stimulation of the premotor area results in movements, but these are somewhat more intricate than those produced by stimulation of the motor area. The premotor area is responsible for programming the intended movements and control of the movements in progress. For example, if your desk is a mess and if you want to lift a pen, you'll have to move all the objects aside, and all this programming is done essentially by the premotor cortex. Now let's come to the frontal eye field, which is area 8. So on stimulation of frontal eye field, eyes will be deviated to the opposite side. For example, if you stimulate the frontal eye field of the left side, both eyes will look towards the right side. How does this happen? Let's take a look. So how does this happen? For example, this is the left frontal eye field. On stimulation of the left frontal eye field, both the eyes will look towards the left side. So the left frontal eye field will send impulses to the right paramedian pontine reticular formation. Left frontal eye field to right paramedian pontine reticular formation. From here, impulses will travel to the abducens nucleus of the right side. Now, via the abducens nerve, the lateral rectus of the right side will contract, shifting the eyeball to the right eyeball to the right, that is more laterally. Now the abducens nucleus will also send impulses via the medial longitudinal fasciculus to the oculomotor nucleus of the left side. This oculomotor nucleus of the left side via the oculomotor nerve will result in contraction of the left medial rectus muscle. On contraction, the left eyeball will move towards the midline, that is, the gaze will be towards the right side. So by this we understand that the left frontal eye field will result in deviation of both eyeballs to the right side. Now let's have a look at the anterior prefrontal cortex, which is area number 10. This area essentially has to do something with personality, your problem solving abilities, your executive function, your motivation, like what is your social behavior, do you talk appropriately at appropriate places, and your abstract thinking, your intelligence. So essentially your prefrontal cortex determines how good and smart you are as a person. Now let's come to area number 44 and 45, which is the Broca's area. This is the motor area for speech. For example, if someone asks you what is your name, you immediately answer. This is done by the muscles of vocalization, which are under the direct control of the Broca's area. So if your Broca's area is affected, the motor component of your speech will be affected. For example, there will be a great difficulty in talking. Now we come to the parietal lobe, which houses area 312, which is called the primary somatosensory cortex. It is situated in the postcentral gyrus. This is the superolateral surface, and let's see where it is on the medial surface. This is area 312 on the medial surface, just posterior to the paracentral lobule. It receives projections from the ventral posteromedial and ventral posterolateral nuclei of the thalamus, conveying impulses received through the medial, spinal and trigeminal lemnisci. So if you want to understand this more clearly, please go and check out my video on the ascending and descending tracts. Like in the motor area, representation of various parts of the body can be mapped out in the somatosensory area. So this is the medial surface, this is the superolateral surface. Impulses from leg or lower limbs will reach here, impulses from the upper limb will reach here, impulses from the face will reach here, just like the motor homunculus. An important thing to note is that the area of the cortex that receives sensations from a particular part of the body is not proportional to the size of that part, but rather to the complexity of sensations received from it. Thus, the digits, the lips, and the tongue have a disproportionately larger representation, as you can see here. So now we come to the Wernicke's area of speech. This is the sensory area of speech, which is situated in the superior and middle temporal gyrus. It should be more anteriorly, somewhere here. So this is the sensory area of speech. Like for example, with an intact Wernicke's area, you will be able to comprehend or understand what the other person is saying, as opposed to the Broca's area, which if involved or damaged, you will find it really hard to answer questions. Your comprehension will be absolutely normal. You will understand what the other person is saying, but to speak something will cause a great deal of difficulty. So with a damaged Wernicke's area, one will not be able to understand what the other person is saying. Now let's come to the primary visual cortex in the occipital lobe. The tract proper, we'll discuss the optic pathway, the lesions of the optic pathway in some other video. So for now, just remember that if the lesion is in the primary visual cortex, there will be congruent homonymous hemianopia with macular sparing. One important point to note is that Broca's area and Wernicke's area will be affected. That is, motor aphasia or sensory aphasia will result only when the dominant hemisphere is affected. So guys, now let's see how different fibers from different areas travel down into the brain. So as we can see, brain is this huge and spinal cord is this small. So fibers cannot pass as they are. So what happens is there is a condensation of these fibers. So these fibers come and get compacted in a particular area, and from there they descend downwards. This compacted area is called the internal capsule, which is not exactly a midline structure, so we can't see the internal capsule on this side. So that was the function of internal capsule. It is a compact collection of all fibers going down the brain. So guys, now let's have an overview of the blood supply of different part of the cortex. So as you might remember from our discussion that this was a primary motor cortex and this was a primary sensory cortex. So as you can see here, this particular part is supplied by the middle cerebral artery and this is supplied by the anterior cerebral artery. So these on this location there were fibers for upper limb, face, tongue and pharynx, and this part had fibers going down to trunk, lower part of the trunk and the lower limbs. So what happens if there is a lesion here? If the blood supply to this part is cut off, what will happen? So we will get opposite side, we will get a weakness of upper limbs and face on the opposite side of the body. Why opposite side? Please check out my video on the pyramidal tract to know this. And if we get and if the blood supply of anterior cerebral artery is hampered, if this region is hampered, we will get weakness more in the lower limbs on the opposite side. So this was what if the motor area was affected. Now what if the sensory area was affected? Same way, if this area is affected, we will get loss of sensations in the upper limb, the face, and if this area is affected, we will get sensory loss on the opposite half of the body, especially the lower limbs. So this part is supplied by the anterior cerebral artery and this part by the middle cerebral artery. So I hope you understood this lecture on functional areas of the cerebral cortex and the homunculus, which are essentially important since we want to discuss stroke in our further videos. Thank you so much.